Hi. So this is going to be the first, hopefully, of many topical short videos that my patients can watch on my new YouTube video channel. And I'm just going to start and basically speak like I would or I do when you're in my office. And here we go. So, hemoglobin A1C. Why is that the first topic I'm talking about? Well, as I tell most of my patients, the blood test that I do, as extensive as it is with things like inflammatory markers, certain metabolic markers, heavy metal markers, heavy metal levels, as well as the routine blood testing, out of all of that, in my opinion, and based on medical facts, the hemoglobin A1C is probably, for the general population, the most important blood test. Why is that? Most people understand it as being an indication of their level of either diabetes, pre-diabetes, or not being a diabetic. So it's an averaging of about 3 to 4 months of all the fasting blood sugars. So if you've been in my office, you know your number, because I tell people that's the only number that I want them to remember. But far beyond it determining if you're a diabetic or a pre-diabetic, it's going to determine the likelihood of many diseases. It's not going to predict exclusively if you're going to get one of those diseases, but I'll give you an example. Most cancers that develop are going to be much more common, much more aggressive in patients that are either diabetic or pre-diabetic. Diabetics have more cancers than pre-diabetics, and pre-diabetics have more cancers, generally speaking, than non-pre-diabetics. These cancers are generally, statistically, again, the solid tumors like breast cancer, prostate cancer, pancreatic cancer, colon cancer, other cancers. There's been no direct link between the blood-borne cancers and diabetes. However, we know, going almost on 100 years ago, based on a Nobel Prize of 1931, Otto Warburg taught us the Warburg effect, which is generally the only thing that a cancer cell can eat is carbohydrates and sugar. By doing so, those cancer cells are immortal. They grow. They also, just like every other animal, you could say, they produce more of themselves, and that's how cancer develops. So oftentimes a cancer that presents itself in a life-threatening manner or even diagnostically found is 10, 20, 30 years in the making. So the assumption that maybe you have cancer cells in your body would allow you to understand that cutting off their food supply, which in turn translates to less carbohydrates, which in turn translates to a normal hemoglobin A1C. So again, it's used as a marker for many disease processes. You can read the list. There's many more from there. In addition to the ones you see there, cancer, heart disease, brain disease, blindness, kidney failure, there's liver issues. So many physicians, their livelihood now is based on treating diseases that were directly related to diabetes or just consumption of carbohydrates, whether they be sweet sugars or the starchy sugars such as white flour, white sugar. They're all generally the same. Fruit is actually maybe even worse because that's all fructose. So if you're juicing an orange, that's much worse than eating an orange, all that juice. So sugar is always going to be something that we need to try to avoid, especially since we are inundated with it. So the hemoglobin A1C is also something that you can control. So many patients are in the diabetic range or the pre-diabetic range. I won't go through the values now. Everybody should know them. But it is also a number that's easily controlled through lifestyle changes such as ketogenic dieting, practical keto, low carbohydrate dieting, exercising, especially in a fasting state. And so the hemoglobin A1C is not just a marker of imminence of disease. It's something that may be a marker, a warning sign maybe. Obviously, if you are a pre-diabetic or a diabetic, it's essential that you understand what that number is, and so you can improve it by the means that are available, which hopefully can be lifestyle through diet, exercise, maybe supplementation. So this is the number. I tell everybody when they walk in my office, don't ask me what your cholesterol is, because most people's cholesterol is really unimportant to their overall health, in my opinion. But the hemoglobin A1C is very important for everybody's health, both as a predictor of future disease, but also a potential risk of present disease if it's abnormal. So hopefully this was helpful and educational. Look forward to interacting when I see you in my office to go over your specific blood test. Have a great day.